Hello everyone, myself Dr. Monalisa. I am going to describe today some of the MCQs of NEET PG anatomy subject, and you can use my referral code DRLISA-YT for 10% discount on Unacademy platform. Also here there is a link of Telegram group of Unacademy NEET PG platform. This is a very useful link. Please join this link. So many of the MCQs by great educator is being discussed on this Telegram group. So after that, I would like to just discuss few MCQs for today's session of NEET PG platform starting with today's session. So the first MCQ which I am going to discuss is this: gland of Van Ebner's is present in. The four options are given: cervical, penile urethra, tongue and vagina. So for solving this, what is given in this MCQ is Van Ebner's gland. So it is important for us to know what is Van Ebner's gland, where it is located. So I would like to firstly describe this. Now see this diagram. Now this is a diagram, this is a histological slide of the tongue showing circumvallate papilla. What you can appreciate here is the circumvallate papilla. Okay. So the shape of the circumvallate papilla, which you can see, is moat-like. As you can see, this hole is this, and there is a depressed area on either side. This is called as hole as a moat. Circumvallate papilla is associated with taste buds, as you can see in the moat, on the depressed lateral walls, as you can see. And in association with this, close to the circumvallate papilla, we have got serous glands. Now this serous gland is of Van Ebner's gland. This serous gland is called as Van Ebner's gland, which has got watery secretion, and it is located in association with that of tongue. So the option which is given in the diagram is clearly it is Van Ebner's gland. The answer will be the tongue. So this is the correct answer because it is located, as we have seen in the histological slide, that it is lying in close association with the circumvallate papilla. Okay. Now coming to Van Ebner's gland, further description, one or few lines about this. Now this Van Ebner's gland is a serous type of gland. What is the location? The location is close to circumvallate papilla of tongue. Okay, if we want to know the exact location of circumvallate papilla, it is lying just anterior to, circumvallate papilla is lying just anterior to sulcus terminalis of tongue. Now in the tongue, if you will see this, the tongue will be like this. There will be a triangular sulcus. This triangular sulcus is sulcus terminalis, which will divide tongue into 2/3 anterior and 1/3 posterior. The location of the papilla will be just anterior. The yellow dots which I am making is the location of circumvallate papillae, and this lies just anterior to the V-shaped sulcus terminalis. So the V-shaped sulcus terminalis, just anterior to it lies the circumvallate papilla. So we have done with the first MCQ. Now coming to the second MCQ. The second MCQ is Coronal septum is located where? This is, we have to know what is this coronal septum in this MCQ. Options are petrosquamous suture, temporosquamous suture, petromastoid and frontozygomatic suture. So it is important to know where this septum is located and which type of suture is it. Now just see the other diagram. This is showing the coronal septum. Actually this septum is a junction. This is a junction or suture which is formed between the petrous part of temporal bone and that of squamosal part of the mastoid part of the temporal bone. So what we can see here, let me just show you. Can you see this septum? Now what is the septum? This is coronal septum, and the location is between squamous part and the petrous part. So in the temporal bone, we have got two parts. One is this petrous part, which is very hard. What is the meaning of the word petrous? The meaning of the word petrous means very hard structure. Okay, and the other is the squamous part of the mastoid bone. So that junction is called as coronal septum. So we have approached to the answer. The basic points I just want to write. Coronal septum is which type of suture? It is petrosquamous suture. It's a petrosquamous suture, and it is a junction between two parts of the temporal bone. So junction between petrous part and squamous part, that is squamous part of the mastoid air cell. It's close to it lies the mastoid air cell, and this part is called as coronal septum. So it is important for you to know this suture, which is not so commonly known. So it is important. This was asked in the previous NEET PG entrance examination. Other important thing, the clinical aspect. Why it is important, I will tell you, because one of the clinical aspect is related to this. Sometime in condition called as cholecystoma, the condition which is called as, please write down that. The condition that is cholecystomas, in which what happens, there is destruction of the keratinized squamous epithelium of middle ear cavity. And in this condition, there is destruction of both petrosquamous suture. In this, there will be destruction of both petrosquamous suture and that of ear ossicles. So there is restriction of both the thing. It is very important to keep these points in the mind. So again, we will come to the MCQ. So what was the MCQ? Again, this is a direct MCQ. All the MCQs which I have framed today is not very much twisted. It is direct only. Only the thing is that some new terms has been included. So you should keep eye on these new terms. So coronal septum is seen where the correct answer will be petrosquamous suture, which now we have seen and also seen the explanation. After that, coming to the third. The third MCQ is Turkish saddle refers to which structure? Okay, Turkish saddle. Okay, so Turkish saddle is lying in close association with which structure? Options are pituitary gland, amygdaloid body, hypothalamus, and uncus. So coming to the diagram, firstly I would like to show you the diagram of Turkish saddle. Can you see this red highlighted area? This red highlighted area is Turkish saddle, which is seen in the middle ear cavity. This is seen in the middle ear cavity. When we will see the interior of the cranium, there is 3 cranial fossa, and in the middle ear cavity, this Turkish saddle, which is also called as sella turcica, is located. Sella turcica, because the shape is like when you will see the horse and horse riders sit on this, that shape is called as sella turcica. It's saddle shape. Okay. Now here one of the important gland lies, that is pituitary gland, which is, and because of that reason it is also called as hypophyseal fossa. So this is the location, as you can see in the diagram. Okay, this is located in the sphenoid bone. Okay, so we can say Turkish saddle. Turkish saddle, which is also called as sella turcica, is located in middle cranial fossa in the sphenoid bone, and it is bounded anteriorly by chiasmatic sulcus and posteriorly by dorsum sella. So on the posterior aspect there lies dorsum sella, on the anterior aspect lies the chiasmatic sulcus, and this chiasmatic sulcus is also called as the tuberculum sella. So it is lying in close association with tuberculum sella. So these are the points which should be kept in mind while solving this MCQ. So we have seen this. Now here again coming to the diagram, this will be tuberculum sella and posteriorly is the DS, that is dorsum sella. And what it contains? It contains an important organ or important structure, that is the pituitary gland. It contains an important gland, that is pituitary gland. Because of this it is also called as hypophyseal fossa, because pituitary gland is also called as hypophysis cerebri. The other name of pituitary gland is hypophysis cerebri, so it is also called as hypophyseal fossa. So coming to this MCQ again. Now this is again a direct question. The answer of this will be Turkish saddle is related to option A, that is pituitary gland. Amygdaloid body, hypothalamus, uncus, these are all structures of neuroanatomical structure which is not located in the Turkish sella or the Turkish saddle or sella turcica. Now again coming to the next MCQ. Now before that, please see this diagram. Here I have just shown that this is the sella turcica which is in the sphenoid bone, which I was explaining in the session. Then what you can see, this is the sella turcica which is located in the sphenoid bone. As you can see, this fossa is hypophyseal fossa or sella turcica, and as you can see, this is containing which gland? Pituitary gland. And also in this diagram it is shown the two lobes of the pituitary gland, and this part which you are seeing is the pituitary stalk. So it is quite clear that sella turcica is containing pituitary gland. Now coming to the fourth MCQ. Which area is out of the blood-brain barrier? Okay, again 4 options are given: area prostrema, loop of Henle, optic nerve and seminiferous tubule. So we have to firstly know what is blood-brain barrier and which area is not containing blood-brain barrier. So coming to this, blood-brain barrier. Blood-brain barrier, we can denote it with triple B. It is formed by endothelium of capillaries. It is formed by endothelium of the capillaries. Other than that, the next layer is basement membrane. Okay, so always we have seen there is an endothelium and it will rest on the basement membrane of the endothelium. Next layer is basement membrane of the endothelium, and the third layer is food process of astrocytes. In association with it, we have got other structures like neuroglial cells, and also we have got ground substance. So all these structures together contribute to the blood-brain barrier, which is shown here, that is the blood-brain barrier. So certain areas are there which doesn't have this blood-brain barrier. So we can remember that areas by a mnemonic, that is SONA. So actually the structures which is not containing blood-brain barriers are together called as circumventricular organs. So the structures which is not containing blood-brain barriers are called as I will write here circumventricular organs. They are called as circumventricular organs. Okay. Now circumventricular organs, why they are called as circumventricular organs? Because they are found in association with the third and the fourth ventricle. So what is S stands for? S stands for subfornical organ. So this was the first. The second is O, which is standing for organum vasculosum, in close association with lamina terminalis. third is neurohypophysis. And the fourth is area prostremia. Prostremia. This is lying in close association with, we have seen this area in the floor of fourth ventricle. Cutting means it is considered as the vomiting center. So again, coming to the MCQ. So the MCQ here is, which area out of the following is not having or is out of blood-brain barrier? So loop of Henle has got optic nerve, seminiferous tubule, all have got blood-brain barrier, and the option A is the correct option. So we can remember the structure not having triple B, that is blood-brain barrier, by the mnemonic SONA. And after that, coming to the fifth MCQ. Distance of lower esophageal sphincter from the upper incisors. Okay, so there in the esophagus we have got certain areas where there is constriction. So it is in this MCQ, what is asked is the distance of the lower esophageal sphincter, means the level where the esophagus is piercing the diaphragm, from that of the incisor teeth. So for this I would like to show you one diagram. Okay, in this diagram you can see the sites of esophageal constrictor on one side. This is the site of esophageal constriction. On the other side, what you can appreciate here is the distance from the incisor teeth. So the first constriction is pharyngoesophageal junction, means where the pharynx is continuing to become the esophagus. That level is C6. What do you mean by C6? 6 cervical vertebra is the level where the pharynx continue to become as esophagus, continued as the esophagus lower down. And the distance from the incisor teeth is approximately 15 centimeters. The second constriction level is at the level of arch of aorta. Again, the thoracic vertebra level is T4 and the distance is 22 centimeters from the incisor teeth. The third is left principal bronchus crossing, and it is at the level of T6 vertebrae. It is at the level of T6 vertebrae and it corresponds to 27.5 centimeters distance from the incisor teeth. The fourth constriction level is that of right crest of diaphragm, in which there is an opening, that is esophageal opening, and the lower end of the esophagus pierces the diaphragm. And this is approximately 37.5 centimeters, corresponding to T10 level of thoracic vertebrae. Now coming to the MCQ, 4 options are there. As you can see, distance of lower esophageal sphincter from the upper incisor teeth. So we have seen the incisor teeth level, we have taken the landmark of incisor teeth and then seen the distance. Okay, so in this, the correct answer will be option D, as you know. So we have just discussed all the distance. The correct answer is option D, that is 37.5 centimeters. So with this, I have discussed the MCQ. Before ending the session, I would like to tell you about the Unacademy platform. It's a very good platform in which so many great educators are there. Also, the platform is very friendly. So many of the free classes has been introduced. So I will just give a brief how you can subscribe for this, and you can become a member of this for the NEET PG platform. So Unacademy Plus platform is the course which is going on, is for the crash course NEET PG now, which I am taking. You can join it. You can also search for me in the Telegram group by Dr. Monalisa Anatomy. You can also search me for the Facebook group, that is Dr. Monalisa Anatomy. Free live classes of mine will come on every Thursday 6 p.m. Okay, YouTube session generally will be released on every Wednesday, and you can follow me by just downloading the Unacademy app, and then you have to go for the NEET PG. Also, you can use my code, that is coupon code is DRLISA-YT for 10% discount on Unacademy subscription. Now this is the link of the link of the Telegram group of the Unacademy NEET PG platform. Please join this group. This is very beneficial if you are preparing for the NEET PG examination. Now I will just these are the steps how you are going to follow this, or you can become the you can just download the Unacademy app. After that, you have to search and find for the NEET PG goal. Okay, then search for NEET PG goal. Then you have to select for the free live classes. For example, here some of the faculties has been, or the educators has been shown. So you have searched whether you want to go for patho class, whether you want to go for medicine, surgery, anatomy, or any classes. So many free classes are available. If you want, firstly go for free classes, just see what is the standard maintained. Okay, and so many free classes are there. You can follow any of your faculty of your choice, and then in that free classes also there is doubt clearing session, there is poll to perform, there is MCQ discussion, there is all MCQ pattern NEET PG aims is being discussed. And after that also, what you, if you want to take the subscription of this, you can just go and use DRLISA-YT YT for 10% discount on Unacademy platform. And please do join the Telegram group of the Unacademy NEET PG. So this is the link of that. And with this, I am ending the session. Hope all the best for your coming examination. Prepare well. All the best for the NEET PG entrance exam. Thank you.